Well, thanks everyone. Thanks for joining us. We're going to celebrate a pretty monumental series of things that have taken place. I'm sure we all agree that children deserve to live carefree lives free of abuse and neglect. We want Idaho children to grow up healthy, well-adjusted, and safe. Yet Idaho struggled to meet those needs in the most vulnerable child and those who end up in our child welfare system. Matter of fact, it's such a good deal that Donald Trump's stealing my guy away from me, but that's another issue. Multiple OPE reports over my period of time have helped us understand the magnitude and that Idaho wasn't doing enough. That stops today. Last June, I issued the Promoting Families and Protecting Children Act, accelerating improvements in our foster care system. At the time, I charged my new director, Alex Adams, with moving quickly to improve the foster system. That's all I said. And since then, we've increased the number of foster homes per foster child. We've opened an office of faith-based initiatives to engage churches and faith-based organizations. We've announced paid parental leave for foster parents who are state employees and invited other Idaho employers to do the same, and some have. We've simplified and reduced the rules and regulatory burdens on foster care. We've expanded collaborative partnerships with businesses and organizations throughout Idaho to support our foster care system. And we've limited the use of non-home living settings such as congregate care and eliminated the use of short-term rentals. Today, I will be signing House Bill 245, putting an unprecedented investment of $23.2 million and 63 new workers to the cause. More help is on the way. These funds will identify at-risk children and youth before they become victims of abuse or neglect. It will provide supports necessary to safely keep kids in their homes and prevent them from entering the foster care system. It will expand resources for those children who do enter the foster care system to ensure they have the right home for them during their time of crisis. It'll expand the availability of treatment foster homes, limiting congregate care only to the most necessary and complicated cases. And it'll bring Idaho children living out of state back home to Idaho. To the state employees gathered here today, I want to thank you for persevering. Your unwavering commitment to Idaho's children, coupled with this extraordinary investment, paved the way for a brighter tomorrow for Idaho's kids. Your work with the help will keep Idaho children safe while keeping them with their families whenever possible, reducing trauma on all fronts. To our 1,199 foster parents, thank you. Your love makes you the advocate and protector of our most vulnerable children. To our many partners, thank you for your dedication to Idaho's youth. And to Idaho's children, we are committed to keeping you safe and well. With that, I'd like to have Director Adams put a bow on all these great things we're doing. Alex?
Certainly, thank you, Governor. I would be remiss if I didn't first and foremost thank Governor Little for the trust that he placed into this department. Last June, when he issued the executive order challenging us to do better for these children, it took everybody up here and more working together. The department responded. Every single person in this department is responsible for helping us improve the outcomes that we've gotten to today. To our foster families and partners, the nonprofits and the community-based organizations, this has truly been a team effort. And lastly, to our partners in the legislature for understanding the vision of what we were trying to do and why we needed to do it. As those of you that watched JFAC knew, they did perhaps put agencies through the ringers, maybe a little bit more than previous years. So to see a 20% increase in funding in the child welfare system really spoke to the efforts that everybody here today made in raising awareness and understanding for why this is necessary. So thank you, Governor, for the trust you put in the department. Thanks to our partners in the legislature, and thanks to everybody here for helping us make a meaningful difference in the lives of these vulnerable youth. So with that, turn it over to the bill signing.
You ready for this? So with that, I will sign Senate Bill 1208 on the 9th of April at Sarah Stover just sent me a at 3:18 p.m. There we go. Okay, questions? You're dying, Ruth. Go ahead.
This might be for the governor, this might be for Director Adams. There is a caveat in the licensing staff. Like you said, JFAC was harder on people this year. Agencies, all agencies. If you are unable to reach the 1-to-1 ratio for foster families to foster staff by January 1st of 2026, there are some consequences. Talk to me about that. Are you confident that you'll be able to reach it, and what happens if you don't?
Yeah, let's talk about it. So what we saw from JFAC this year was a focus on performance. They want to pay for performance. They are betting on this team to perform. So when many of us started together, we had 74 foster parents for every 100 kids coming into the system. We said we want to be a state where families are waiting on kids, not kids waiting on families. So we've set a goal of getting 150 foster families for every 100 kids coming in. The legislature saw that and responded, and they said, let's set a goal somewhere in between. They want a 1-to-1. They want 100 families for every 100 kids coming into the system. And if we don't hit that by January, then they could take away 6 of those staff that the governor spoke to. Do I think anyone up here is losing sleep over that? No, because we are confident we are going to hit that. Today, we're at 94 families per 100 kids. In just a few short months, we've gone from 74 families per 100 kids to 94 families per 100 kids. And we're confident in this investment that it's going to make a meaningful difference. There's a pay increase for foster families. There's advertising money to bring in new foster families. We have one of our contractors here who's helping us reach out to the faith-based community and recruit new members. So we appreciate JFAC for setting that goal, but I can assure you this is a team that will exceed that goal.
Also related to the, sorry, I just I can see you looking at it. To the new positions, 63 is a lot, and kind of health and welfare and state agencies in general have been having a hard time filling positions and keeping people in those positions. Can you talk about what you looked at in terms of funding those to make sure that you can do that?
I thought it was a lot too.
Certainly, we appreciate the governor's support. Having worked with the governor on budgets for many years, I know he judiciously guards the budgets, probably even more closely than JFAC many times. So to be able to work with him and his staff to get these FTP, they knew it was needed and why it was needed. You're going to see some pretty aggressive recruitment. I'll ask Deputy Director Monty Pro to speak a little bit, but you're going to see some unique recruitment efforts starting next week even, so that we can get as many of these positions filled in time for July 1 as possible. So Monty?
Yeah, thank you.
Why don't you come over here so they can hear your glorious voice?
Thank you, Governor. Thank you, Director. Appreciate it very much. It's a great question. What makes us most excited about these positions is that many of them are new work for us. So we get to recruit maybe a different type of person than we've recruited before in the past. Our retention rates and recruitment rates are the best they've been in a long time for our child welfare staff. And so we just think that adding the new workers to the existing workers is going to be a benefit to the new style of work we're trying to do by keeping families together and looking for removal only for those most urgent and safety needs going forward. Excited to introduce that new work into the state of Idaho and homes across the state.
Good.
Idaho's focused on prevention. Are you concerned that there are going to be kids that are not coming into care that should be coming into care?
Well, the question was about kids not coming into care You know, always. I mean, one of the things we do in the safety net business, which is this building right here, is try and make sure that that there's a safety net there. But the other part of the safety net is we want spring in that safety net. You know, we don't want these kids to be in foster care till they're 23 or 24, but is it 23? Is that 23? But we want that safety net to work, but we also want to have and that was part of the reason it was such a big ask. But we want programs in there to where, because every one of those kids that you save and intervene early, keeping them with their family or matching them with the right foster family and are we going to miss some? Probably, there's no doubt about it. When I read those, I know 2 OPE reports, there might have been 3, those OPE reports is very frustrating. And I think it was also frustrating for the legislature, and that's why we had so much momentum by this huge ask for somebody like me and Alex to ask for this. But this is going to be a sea change on what we do for foster care. There will be some kids that don't get through there. But we're going to pick up so many more, and we're going to do having these kids stay at home, doing the work, you know, and JFAC talks about this all the time, that little investment with a current family versus going into foster care versus going into residential or congregate care, the numbers are staggering. That's why we're trying to get ahead of this with this big investment. But there'll probably be some kids, but everybody's definition of who doesn't get into the safety net is somewhat different. But this is such a big event and a big try and an effort by the department and the state that undeniably it's going to be magnitudes better than what it was before. Go ahead.
I also wanted to ask about prevention. Can you talk about what that's going to look like as a policy rollout for families? And can you talk about how the department, if you feel the department has adequate resources to avoid kids getting harmed?
Well, if I look at the fiscal note, yes. But either Monty or Monty can talk about what we're doing about the adequacy. Go ahead, Monty.
Well, I'll start and then I'll turn it over to Monty. So of the FTP that are in this bill, 36 of them will be devoted to prevention. That plus our current team will bring us to 50 total doing prevention. It'll be a team that will be providing oversight in homes. And if you think of some of the primary reasons why people come into foster care in the first place, opioid abuse and mental health issues. So what this prevention team will do will be brokering services and in some cases providing services, connecting these families to substance abuse treatment or mental health services to help stabilize the home situation and prevent kids coming in to begin with.
Yeah, thank you. Not much more to add to that. Director nailed it. We're excited to sort of introduce the new workers into the home to make sure those risk factors are reduced in the home to keep the family safe, while the preventative factors or the protective factors that keep kids safe are elevated. So an unstable home environment, as indicated by biofamily trauma themselves, mental health issues, substance abuse issues, how can we minimize those while increasing the stability of the home will allow us to keep kids safe in the home while continue looking for permanent options to keep kids safe.
From an overarching standpoint, and because Alex has been with me all my career, I ask the question frequently. I asked it before I got this job and ever since I've given it, and it's take a child that's struggling, 4, 5, 6, 7, 8 years old, and then go from there to my correction system, which Monty used to run the juvenile corrections. Tell me all the on-ramps and off-ramps. What's an off-ramp to end up being in the correction system? And we know that the on-ramps are substance abuse, mental health. Those are the things we've got to stop. But those investments early are what stops that progression from a child with some, a family with substance abuse mental health challenges to being going into juvenile corrections and then going into my adult corrections. This is where we're putting money in early. We're putting it in and helping to stop that flow of these kids from a somewhat troubled past to a real troubled past, and it makes them productive citizens. It's a win-win situation with an investment, and this is a very bold investment. So I'm proud of what we've done here. So.
All right. Thank you, everyone.
All right, thanks, Joan.